Hello, and welcome to this webinar about LGBT health, mental health, and particularly in view of COVID. My name is Michael King. I work at UCL, and I'm an epidemiologist who's been interested in mental health of LGBT plus people for many years. And we're very lucky today because we've got three panelists. I'm going to introduce them very briefly. Raj Mariwala from the Mariwala Health Initiative, Bonnie Sepora, who you won't be able to see because he doesn't have a webcam, but he's from Open Hands, Botswana, and Adrian Hyyrylainen-Trett, who's here in England. So first of all, Raj, could you say a word or two about yourself and your organization?
Thank you, Michael. Hi, everyone. So MHI works in India, and we are a mental health funding and advocacy agency with a focus on making mental health accessible to marginalized communities. That means we work with LGBTQIA communities, communities that are marginalized by caste, religion, gender. So that's a bit about MHI and our work, which spans across a few states in India.
Thank you. Adrian.
Thank you, Michael. Afternoon, everybody. I work for ENEI, which is the Employers Network for Equality and Inclusion, and we specialise across all protected characteristics, but one of those obviously is around mental health and disability, and that's one of the reasons why I'm here to talk about, as I lead on LGBTQI issues for ENEI, but also from our global membership development managing position with our global membership proposition.
Okay, thank you very much. And Bonnie, I hope you can hear us. Just a word or two about yourself. Bonnie, maybe you have to unmute yourself. Can you hear us? Just to introduce yourself.
Yes, can you hear me?
Yep.
Okay, so my name is Bonnie Sepora. I'm from Botswana. I am a team leader for the Open Hands project, which seeks to speak for the mental health care and well-being of the LGBTI people in Botswana. We're trying by all means to ensure that the mental health and well-being of LGBTI in Botswana is protected, because due to LGBTI people in Botswana often go through hostility, they go through stigma and discrimination from the society, hence why we thought as this project we can be able to provide mental health care support for the LGBTI community here in my country.
Okay, thank you. Thank you very much. Now, for those of you who are perhaps not familiar with the subject, LGBT plus people tend to have worse mental health than the rest of the population for all sorts of reasons that Bonnie has touched on to do with discrimination and prejudice. And we also know that older LGBT people tend to be more isolated, and youth, LGBT youth in particular, are still suffering from higher rates of mental disorder, even though some countries in the world have more liberal, or many countries in the world have more liberal attitudes to sexuality. And this has all been, as I said, complicated by COVID-19. So I'm going to get straight into the meat of it, because we've got some questions here for each of the speakers. We'll go through those questions, and then there'll be time, a little bit of time at the end for any questions from the people listening and watching. So the first question is for you, Raj. Can you tell us about this repeal of Penal Code 377 that happened in India in 2018? Has that really changed the lives of LGBT people? And does it affect how they access mental health services? Raj.
Okay, thanks, Michael. Excellent question. So the repeal of Section 377, which was a colonial law, meant that it decriminalized sexual relations between consenting homosexual adults. But this has really just been one small step. There are some other laws and provisions that are actually critical to talk about when you ask me this question. And the Supreme Court relied on these provisions when they repealed 377. One was the Supreme Court passed a very important judgment on trans rights in April 2014. Now, this judgment held that the right to life, dignity, and autonomy would include the right to one's gender and sexual orientation. So that's one. The second important law that I want to talk about is the Mental Health Care Act of 2017, which stated that all persons have the right to access mental health care without discrimination based on caste, class, religion, culture, sex, gender, sexual orientation, and disability. Now, this is particularly important, especially if we look at how trans communities, how intersex persons have been historically excluded and discriminated against in accessing public services like mental health, as well as their socioeconomic rights. The problem actually comes in when we look at 377 as a catch-all, when actually there are some other laws in the country, like the Transgender Protection of Rights Act 2019, that are a grave threat to LGBTQIA communities and LGBTQIA mental health. For example, this act takes away the right to determine our own gender. Now, the act actually says that if you want to be recognized as a trans person, you have to get screened and you have to be certified by a district magistrate. Now, the whole idea of screening, certifying, and pathologizing gender, as we all know, has very deep roots in mental health and psych disciplines. So as mental health advocates, we must recognize the damage this does to trans persons. Now, alongside this, in terms of mental health especially, there has been no move to work towards providing housing, social security, anti-discrimination, or affirmative action laws. So I'll just give you a couple of examples. Number one.
Can I just interrupt just for the sake of brevity? I mean, that's been really helpful. One clarification I wanted to make was, for many people, they won't be familiar with the detail of that penal code. And to put it in simple terms, does that mean that gays and lesbians have the right to have same-sex behavior relationships? So that the law has taken away the criminality. Is that what it really is?
Yes, the law has decriminalized it to say, essentially, what the law said before it was repealed was that anything that is not peno-vaginal intercourse is a criminal offense.
Okay.
Which means
the old British colonial. Great, that's really helpful. Thanks, Raj, and we may come back to that. There may be questions about that. Adrian, question for you. Can you describe the current challenges facing the LGBT+ community in the UK?
Yes, absolutely. I think it's one of those issues where there are a range of different challenges with regards to the mental health of LGBTQ people in the UK. Especially one could add that the situation around COVID and the pandemic has added or enhanced those complications around mental health. We have to look at the different relationships, firstly for perhaps people who are living alone, being very lonely, not having interaction and social interactions with friends and family and colleagues, which can be a great source of deprivation from their own good lives that they've been living. But also people who are perhaps living in relationships but are struggling under this pandemic situation, whereby perhaps they're working from home, perhaps their relationships are becoming a bit more frayed because they're used to being with each other 100% of the time. But also, especially for those people who are perhaps not out as gay, lesbian, bisexual, or trans, are living in families where they're not welcome, they're discriminated against. They may be feeling very, very lonely in that position. But they also may then feel that they need to leave, and therefore the crisis of young LGBT people who are homeless has, certainly from the organisations that I've spoken to, has increased over this period of time. And there's a whole range of different other mental health aspects to people's lives, living their lives to be authentic and to be open and honest about who they are. but also having things that affect how they live. So things around mental health and well-being of their own bodies, the body image, fat shaming. Because we're all in lockdown, we aren't going to the gym and having the exercise that actually is really good for our mental health. It means that some people are struggling. There's issues around chemsex and the use of drugs, and the use of, plus being in a very lonely environment is enhancing people wanting to use those in place of having social contact. And there's also obviously people's struggles with their own lives and understandings from having things like conversion therapy, whereby people are persuaded to be someone who they're not, and that can cause an enhanced mental health awareness and issues, particularly over this period of time.
Okay, that's really helpful, and I'm sure we can come back to some of those issues, perhaps with the other speakers, but also if there are any questions. Bonnie, a question to you. Can you hear me okay? Bonnie, maybe you have to unmute. I'll just give you your question. A bit like Raj's situation in India. In June 2019, Botswana's High Court legalized same-sex behavior in what was really a landmark ruling. What's the reality for LGBT plus people in Botswana now, and how does that affect, as I said to Raj, how does that affect their access to mental health?
Thank you very much for the question. So basically, yes, last year the High Court made a ruling to decriminalize the Same-Sex Act of our penal code. But in terms of the effect or the impact of that, I can say that there has been some form of perception changes amongst the Botswana society. But what I can say, it's 50-50. For instance, you've seen more people now becoming more receptive towards LGBTI people in terms of like accepting them and tolerating them and appreciating diversity. But at the very same time, the ruling had made other section of the society or other sector of the society to sort of like backlash LGBTI people. So it's 50-50 in a sense that we see certain members of the community accepting LGBTI community in the country, whereas at the same time we see other people still stigmatizing LGBTI people further, but what I can say, the good thing is that at least the ruling has created a provision or a platform for demand creation in terms of access to mental health services. Prior to that, LGBTI people were afraid to even talk about their mental health well-being because of the fear of stigmatization. But after that ruling, at least we gradually seeing LGBTI people wanting to access mental health. And I must just emphasize that with our current project Open Hands, we sort of created a platform through the Open Hands project, for LGBTI people to feel okay, to say, you know what, I need help. I'm struggling, I'm experiencing depression, I'm having suicidal thoughts. It's okay to talk about it. So the Open Hands project has sort of enabled that conducive environment for them, for LGBTI community to talk about their mental health and well-being. But all this resonates with the judgment of the High Court case last year.
Okay, that's really interesting and helpful, and really quite positive in India and in Botswana that we're getting law leading public institutes, and I think that's happened in Britain and in other European countries, that we needed equality legislation, we needed this decriminalization, and then later social attitudes became more positive. So I think we hear bad news all the time about gay and lesbian mental health, but this sounds like slightly better news, at least. Raj, can I come to you with another question? because your Mariwala Health Initiative runs and funds some brilliant queer affirmative practices. And perhaps you could tell us a bit more about that work, supporting LGBT plus individuals, and what you've learned from doing that.
Sure. So we do run a course called Queer Affirmative Counseling Practice, which is a comprehensive training for mental health professionals with the idea that this knowledge is coming from the margins. It's coming from the lived realities of LGBTQIA lives, because mainstream psychiatry and psychology curricula still reflects dominant narratives. So this is a course taught by queer trans mental health professionals themselves, which covers both perspective building to recognize inequalities and their impact on mental health, and also provides tools and techniques to address distress and promote well-being of LGBTQ persons. Other than that, we have a peer support practice course that we run with LGBTQ collectives, which is to use really to teach some more mental health practice skills, to work with support seekers and ethics around power and boundary setting. And then we work with LGBTQIA collectives and community-based organizations who have drop-in centers, youth-led collectives, and provide shelter, legal, and medical support alongside mental health work. I think our learnings are that it's very important to foreground the historical violence from the edifice of mental health or side disciplines itself, and to use the knowledge from the margins to ally with LGBTQI communities for anti-discrimination and affirmative action policies as mental health advocates.
Thank you. And have you learned anything about the resilience of gay and lesbian people? You know, that comes through a period of great discrimination. I wonder if you had any insights into how do they manage to do it?
So I think when we talk a lot about mental health and LGBTQIA mental health, many times we forget to center the decades of care work, activism, and support that trans and queer activists and collectives and communities do for themselves. And I think community building and activism has really been the strength. Collectives, LGBTQ collectives, and I feel like that's the form of both resistance and resilience for LGBTQI communities.
And do you have any out gay or lesbian politicians in India?
Well, we do have quite a few different trans politicians. So there's some very good prominent trans women who are at the forefront, as always. So thank you to the trans women.
Always at the front of protests. Yeah, that's good news. Adrian, another question for you. Could you tell me a bit more about your work as an ambassador for a specific LGBTQ+ mental health space? And tell us a bit about what that means and why having spaces like this is so important.
Yes, absolutely, Michael. I think I do it in a range of different guises, in the sense that being your authentic self at work is absolutely critical, and the organisation that you work for has to have that understanding around inclusion and diversity to be able for people to thrive and for people to be at their best. And therefore, I'm very open about my mental health challenges over many years. I talk about them openly in the organisation, because it also helps others then feel that they have somewhere else to go to, or to recognise that their challenges are similar to other people's. And the more we talk about it, the more open we are about it, the better it is for everybody. So apart from doing it within the ENEI space and talking about my journey, I've had several suicide attempts over the years. I have had other mental health problems around chemsex. So there's been a variety of different issues that have come up. But at the same time, I do some work with a Create Space, which is a mental health for men's mental health, particularly gay men's mental health, to try and support their ambassadorial work in terms of putting out there the discussion around mental health, but also the other elements that go with it around body shaming, around eating disorders, and around all those things that perhaps people really don't feel comfortable talking about. And one of the other things I do is I do some modelling for the Worldwide Raw, which is a Sport Allies mental health charity, men's mental health. It takes all men, so straight men, gay men, bi men, trans men, and from all different backgrounds and ethnicities to talk about men's mental health, which is something which generally men struggle with. We know that the high proportion of suicides are from men, particularly in their middle age, and that's partly because men are sort of not encouraged at a young age to talk about their emotions and feelings, and that's why being authentic about those is so crucial, and to be open to those discussions in the organisations that I work for, but also in my advocate's hat to talk about mental health.
Okay, you've raised a very interesting area, and that's the dread word sport, because within sport we have so few women, we have so few men, gays and lesbians, and that are out, especially in football and some of those sort of sports, and the trans community face a real dilemma over athletics and all that sort of thing. And have you got any brief things to report on that theme? I know I'm throwing into your lap a very complex question, but it's interesting that you mentioned it.
No, it's a really important question. It's something I do a lot of advocacy work in sport as well. I happen to be an amateur golfer, powerlifter, footballer, wrestler, various different sports, but also work with the sports media LGBT plus group, which really advocates on making sure that journalists and people talk about sport and talk about LGBT people in sport in the right way. And that's ensuring that there's inclusion, particularly around trans elements, which have been in the media over recent months, and making sure that sport's available for everyone. You're absolutely right. We still haven't got the first openly out gay professional footballer in the Premiership. I recently seen that the FA have taken up mental health as being an activity they want to do a lot more on, but they didn't actually have a video that was released yesterday, I think, but they didn't have any LGBT plus people in it who are sporting advocates. So again, I think that's missed a trick slightly in not making sure that all areas of inclusion are covered. And I think sport is one of those areas where it particularly affects people, especially from a young age. I know from my own experience that I love sport, but knowing as I was gay at an age of 7, I was then taken away from sport because I felt I didn't fit, and all the regular bullying and harassment that goes on at a young age and through teenage years at school, and that I dropped sport from my enjoyment, and I've only come back to it recently, thankfully, through friends and colleagues who I've taken up golf and other sports with to come back to it. But it's taken a good 27 years to do that, and that really shouldn't be the case in that way, that we get sort of taken away from sport at such a young age.
Okay, that's really interesting, and I mean, you know, there are many links between sport and mental health as well, which you're alluding to, really. Bonnie, there's another question for you. What is the focus of Open Minds' work to promote and protect the mental health of LGBT plus individuals? What sort of lessons have you learned from that work?
Okay, thanks for the question. So basically, just to give a background about the work of the Open Minds project as it stands. So initially, we are doing what you call self-love therapy sessions, you know, where we get to convene as the LGBTI community, get to share one another experiences, difficulties, and all the likes. But due to the COVID-19 pandemic and the lockdowns and stuff, so the strategy has somehow shifted to more of digital engagement, which what we are doing now is we're doing one-to-one follow-up calls. We call them mental health random checks, where we largely use telephone, WhatsApp calls to reach out to our community, just see how they're doing, how they're keeping up and stuff like that. And then we also rely much on our stakeholder support, the fact that we have relationship with different stakeholders, NGOs. So at times we do refer our people for maybe online therapy, the therapy services provided by other organizations which are providing mental health care support and stuff like that, who are more capacitated. So we tend to also do referrals in that style. Then we embrace values of care, diversity, fellowship in our approach. We believe that one of the key values in the Open Hands project is the value of care. Whatever we are doing is that LGBTI people are going through a lot. Their mental health is at stake. So the approach that we use, it's central to the value of care. In anything we are providing a caring, and the reason why it's called the Open Hand is that it's a place of safety. So we are, through the project, we are trying to create a safe space where people can freely share their experiences, their difficulties, and all the likes. But in terms of the lessons that we have learned from our approach is that the ecological model is very important. Including other people or adopting a holistic approach in providing mental health care services is really critical, because it taps on the skills and the strength provided by other people, not necessarily us, only. So we are engaging as many professionals as possible to help our LGBT community members to get the support that they need. And then the other lesson that we learned is the principle of nothing for us without us. We believe that that principle is very important. It shows that for in anything, you need to, the people who are experiencing the hardships, in this case which are the LGBTI plus people, they need to be at the forefront. They need to be at the forefront of the change process. I think that's one thing that we've learned from our work. And then one thing that we also have observed from our work is that things are difficult when there are no resources, when there are no financial resources, particularly during these difficult times of the COVID-19 pandemic. It means a lot of things. It means most donor funding has freezed. You really can't. Most of our members, most of them here in Botswana are unemployed, so they really can't even use, actually even afford data, to communicate. So it's hard because you want to help people, but at the same time, the access or the affordability of actually buying internet data and stuff like that is very, very costly here in Botswana. So it's a bit problematic, and I think it's one key thing that we've also learned and appreciated in our work.
Okay, that's really interesting. It's something we don't necessarily think about in Europe and North America, about the costliness sometimes of getting online, or even the ability to get online during a lockdown,
Yeah.
and things are repaired and so forth. Okay, well, that's really helpful, and I'll come back to you all to give us your sort of priority areas in a moment. But we have a question from the audience for Raj, and the question is, your queer affirmative counselling program, and I think it's a question from India. How can we make that program accessible to more and more mental health professionals across India?
So the idea, of course, is to reach as many people as we can in India, and we're doing that in a few ways. I think what's upcoming, hopefully soon, is a free-to-use queer affirmative counseling practice manual that anyone can download and use. So that's one. We hope to have it in languages other than English as well. And of course, continuing our in-house QACP course. So I think these are the two ways, but we hope that the manual will be downloaded by as many mental health practitioners as possible.
Okay, thank you very much. And we've got another question for Raj. Your Courage was very popular this afternoon. Well, it's afternoon in England, at least. This question is from a student, though, in the London School of Economics LSE in India. So it's branch of the LSE in India. How does caste play a role in the LGBT plus mental health experience?
Excellent question. Caste as a phenomenon in India touches all aspects of life. So of course it touches LGBTQ lives as well. And there is an intersection between the historical marginalization and exclusion of people from Dalit, Adivasi identities and people who are trans. There is definitely, in terms of LGBTQ community activism and leadership, the representation is far more upper caste, and that's really a problem that we need to look at, call out, and actively need to work towards calling out caste discrimination within LGBTQ circles, as well as when we look at rights and mental health practice. It cannot just be done from an LGBTQ lens. We need to also have a very strong anti-caste lens to take that on.
All right, thank you very much. That's very interesting. Now, what I'd like to do, we may still fit in more questions before, but I wanted to make sure that that I could invite each panelist too. So what I'm going to invite you, and I'll name you one by one, to briefly end up with naming your top priority action or top priority message that you would put out for improving access to and improving the quality of mental health services for LGBT plus individuals. So Adrian, what would be your top priority or action?
I think for me is in ensuring that mental health awareness is a sort of mandatory thing throughout all organisations and training for everyone. I think it's been coming along. It's something that I know some companies are doing, but I know a lot of other ones aren't. So I think for me, having that awareness training in the workplace means that people are far more aware of perhaps where they're being insensitive, or they say perhaps some microaggressional comments which they perhaps don't mean to be intentionally affect someone, but they actually do. And I think we need that understanding to be better, so people can then be more open about their mental health conditions in the office, in different organisations. And with that awareness training, people are then far more aware of the sensitivities and the ways that they treat people. And I think doing that holistically as an inclusive and authentic way of ensuring that people's different lifestyles, different ways of living are seen through a open and inclusive and celebrative lens rather than anything critical, would be my sort of primary objective, I think.
Great, thank you very much. Bonnie, can I come to you? What would be your priority action or message for improving access to and quality of mental health services?
Well, my top priority message, I guess it's emphasizing the importance of adopting an intersectionality approach, and also stress the point that LGBTI people do not live in a vacuum. So it's important to provide, to empower people who are not just LGBTI people, but empower family members of LGBTI people, for instance, because they lack in most cases here in my country, they lack knowledge insofar how they can support the LGBTI family members. So I think it's very important to, adopt that intersectionality approach, such that it's the people in the environment where LGBTI are living, and LGBTI people are living almost everywhere. So people really need to know, people need to be empowered, people need to be educated. They need to be educated how mental health care, or how mental health difficulties affect, LGBTI people, So they really need to know these things. We need to keep on sensitizing them. I know we are doing it, but I think we just need to accelerate at the rate in which we are, empowering or sensitizing the community about mental health and LGBTI plus community.
That's really interesting. And you mentioned this complex word, intersectionality. I just wondered, I mean, for people who are not actually sure what that word means, it sort of means the cross-cutting themes of maybe religion, caste, as we've mentioned, class and things like that. But does religion in Africa, is there an interaction here? Are there different attitudes in different religions, do you think?
Yes, there is that there is that intersectionality, because if one is gay, for instance, or if one is lesbian or trans, they belong to a certain religious system. They belong to a certain cultural system, political system. So it's very important to integrate all this systems or all this sectors, because you'll find that stigma and discrimination, it might come from the church, me being gay, me being Bonnie, me being gay. For instance, myself, I'm a Christian, but what I experienced from going to church, I had experienced stigma from my church, which is supposed to be a place of security. So it's very important to also educate, put the information across all the sectors in the society. Even in the political system, we are political beings. We vote. Sometimes politicians, not all. There are politicians, for instance, in Botswana who are LGBTI pro, but then they would have those other politicians who are actually in power, but they are not LGBTI pro, and that's a problem there, because remember, those are our legislators in most cases. They make laws, they make policies. So we might be disadvantaged because of other people's perception, which are largely influenced by religion or the cultural philosophies whatsoever. So it's really important to adopt that intersectionality, that cross-cutting approach when dealing with the issue of mental health and LGBTI plus people.
Yes, because as you've said, you don't really understand the people, the gay and lesbian people, where they're coming from if you don't understand those backgrounds, but also the people who are handing out the prejudice. There's all sorts of intersectionality there too, so I think it's really interesting. Raj, can I come to you last and say what would be your priority action or message for improving access to mental health services for LGBTQ plus people?
So I think before we talk of improving access, we have to talk about the very real historical legacy of violence and oppression from within the institution of mental health, and which is why a lot of people don't feel safe to go to mental health practitioners or therapists. And one of the ways to do that is to inculcate knowledge from the margins, inculcate LGBTQIA lived experience. So that's one. But the other point is, as LGBTQIA mental health advocates, we must know that it's not enough just to provide services, but we also have to strongly advocate for and ally with LGBTQIA communities, for anti-discrimination laws, for affirmative action policies and practices, and other such welfare schemes.
Absolutely. I mean, I think it's very important, and your historical point is absolutely vital. Things like diagnoses, things like conversion therapies arose from psychologists and psychiatrists. They didn't arise from the general public, but they were a product of their time. And I think they were mental health professionals not seeing past the cultural prejudices of their time. And I think it's amazingly important that we keep a focus on that. We've had a comment, not a question, a very interesting one saying, I'm a trained psychologist and LGBTQ, I can never get that mouthful out, LGBT plus training was never touched upon. So we haven't got time to go into that, but it's sure clear that we're not educating the professionals very well. And there was another quick comment before I ask you all to just sum up with one closing statement. And that this comment was, are there any books or reading material that one can refer to be more equipped with queer affirmative counselling practice? And maybe anyone could answer that, but Raj, you first, is there any one book that you could send people's way or suggest?
Well, a couple of our faculty members already wrote something called the Gay Affirmative Counseling Practices Manual. That's the QACP is now the next in line for that. So that exists and it's available for free download. But I believe, and that's Indian context based, but I do believe there are some important academics in the UK who are doing work on this. I know there's someone called Meg Barker who writes about it. There are a couple of others. The name is eluding me, but I will come back, Adrian, or maybe Bonnie, you can answer till then.
Yeah, no, you're quite right. Yeah, Adrian, you look like you might have a suggestion.
Yes, no, I'm actually reading a book currently, and that's what I just quickly got from my shelf. I don't know if you can see it here. It's How to Become a Mental Health Leader in the Workplace, and it's by James Fairview, and it happened to be recently sent to me to have a good read. I've started reading it, but I think it's a very good grounding from what I've read so far as a starting point to have someone who's an advocate and a leader in the workplace. So that's something I can take off the shelf and to talk to you about.
Good, we're running out of time very quickly, so could I ask you each to do a sort of 30-second closing statement? I know it's a bit unfair, but I'll start with Bonnie. Have you got 1 minute closing thing you'd like people to hear?
Oh, okay. So what I can tell the rest of the world out there is that mental health, it's a business when it comes to being an LGBTI plus person. It's very important to design programs that are tailor-made to the mental health care needs of LGBTI people. We have seen in the past that the focus has always been on the biomedical needs of LGBTI plus people, such as HIV testing and counseling. But the mental health and the psychosocial well-being of LGBTI plus has always been neglected. So I think this is it's high time for the world to rise up, and for the activists, for the governments, for the private sector to stand up and ensure that the mental health care, well-being of LGBTI people is promoted and protected. Thank you.
Okay, good point. And speaking of government, the UK government is preparing it to ban conversion therapies. So maybe that's a good move. Adrian, do you have a one sentence summing up closing statement?
Yeah, no, absolutely. I'd like to review back to the intersectionality word. I think that's absolutely key in this particular space. There are so many different perspectives to take on board, and trying to lump individuals into boxes just doesn't work. There needs to be a holistic approach to it, and being inclusive and being authentic about that is absolutely crucial.
Okay, thank you. And Raj?
So I'm also going to swivel back to the intersectionality point, but I think it's very important to look at expert knowledge and critique it like I've said before, but part of that critique also comes from critiquing a more Western approach, and we need to have more voices. Very glad to see Bonnie here. But we do need to have, we do also need to decolonize mental health and queer it. So I'm looking forward to working more on queering mental health.
Absolutely, and I think one of the themes of today was to get away from that European and North American perspective and hear things about where most people live, what's going on. So I'd really like to thank you all very much, Adrian, Bonnie, and Raj, for your contribution. I don't think I've got anything more to say. I think you've summed it up better than I can. So all I want to do is advertise the next one. The next webinar of this type is going to be on the 18th of August at the same time, 2 o'clock British Standard Time. And it's about suicide and suicide prevention in the time of COVID. And I can't believe that gay and lesbian issues won't appear on a theme about suicide. So I'd invite you all to come back and continue the discussion. Thanks, everyone.
Thank you.
Thank you.
Bye.